Hi, my name is Nathan Yawn. Today we're going to be talking about motor disabilities. What is a motor disability? It means an impairment in the ability to move all or parts of the individual body caused by trauma, disease, or any condition affecting the muscular skeletal system, spinal cord, or sensory or motor nerves. The disability may interfere with the development or function of the bones, muscles, joints, or central nervous system. Physical characteristics may include paralysis, altered muscle tone, an unsteady gait, loss of or inability to use one or more limbs, difficulty with gross motor skills such as walking, running, difficulty in fine motor skills such as buttoning clothes, printing, or writing. The first muscular motor disability is muscular dystrophy. Muscular dystrophy refers to a group of genetic diseases that cause progressive weakness and degeneration of skeletal muscle. These disorders, of which there are more than 30 different types, vary in age of onset, severity, and the pattern of the affected muscles. Uh, pattern of the affected muscles. All forms of muscular dystrophy grow worse over time, and muscle progressively degenerates and weakens. Many people eventually have to go to a wheelchair. Some things I've highlighted: muscular degeneration, hence muscular dystrophy, progressive weakness, fiber death, and phagocytosis, and that's where the fibers are broken down and they're destroyed by they were the cells and fibers are broken down by scavenger cells. Fiber branching or splitting, and this is ultimately um, the muscle is replaced by connective tissue such as fibrous tissue and or fat. And you can see down below that I have a video associated with this presentation. A kid walking, trying to go up and down stairs, or I couldn't exactly make out exactly what, but he has enlarged calves and is unable to do so effectively. It's not easy for him. He looks like he has good muscle mass, but no, it's just his muscle has been replaced by fibrous tissue, which has enlarged his. Looks like he enlarged his muscle mass, but no, it's just enlarged fatty connective tissue. What are ways you can have muscular dystrophy? So you can inherit in three ways. Autosomal dominant inheritance occurs when a child receives a normal gene from one parent and a defective gene from another parent. Autosomal recessive inheritance means both parents carry and pass on the fatal gene. X-linked or sex-linked recessive inheritance occurs when a female parent carries the affected gene and passes it along to the male child. And this gene that is defective only happens in males and is the dystrophin gene that is mutated that causes muscular dystrophy. The specific age that it may affect is a wide range, very wide. Um, Here we have Duchenne muscular dystrophy, which is the most common among childhood and is diagnosed as early as infancy. Life expectancy is around 20 years, 20 to 30 years, but with therapy techniques, and other modern technologies, we improved the lifespan to about 30 years here in America. But still, still, var- there's still variability within that. Myotonic dystrophy, also called DM1, is another common form of muscular dystrophy. Typically, disease onset is between 20 and 30 years of age, but childhood onset and congenital onset are well documented as well. What are some person? What is the person's motor abilities with muscular dystrophy? Um, their mobility is usually lost with time and progressively gets worse, and that leads to mobility with only an aid with a wheelchair. Usually, you see early in life at younger ages good mobility, but with braces and other supportive aids. Um, ADLs are affected greatly as muscle degeneration progresses, which becomes more difficult to perform ADLs. This all leads to uh, less independent life, if any independent life activities later in life. Intrinsic muscle movements such as writing, facial expressions such as smiling, or decrease across the lifespan. What is developmental coordination disorder, or DCD, or dyspraxia? I put here two different definitions. DCD and dyspraxia, they are synonymous with one another. We're going to treat them synonymous with one another, meaning that they are one and the same. But literature and research kind of argue between the definition of DCD and dyspraxia, whether they are the same or not. A lot of physicians here in the US lump DCD and dyspraxia together. Uh, so I try to highlight each one accordingly, but they're so similar, they're going to apply to both uh, very much, very often. DCD is manifest functionally by difficulties of all aspects of daily living, and then highlights preschool children. Common features reported by parents include a history of delayed development milestones, particularly crawling, walking, speech, difficulty dressing, poor ball skills, uh, immature artwork, and difficulty making friends and having a social life uh, associated with the mental retardedness. Developmental dyspraxia is a disorder characterized by impairment in the ability to plan and carry out sensory and motor tasks. Generally, individuals will decrease with, with the disorder appear out of sync with their environment, although individuals with this disorder may have an average or above average intelligence, meaning they are one and the same with you and me, and they may behave immaturely. Keep that in mind. Um, what are some causes? If you were born prematurely before the 37th week of pregnancy, and especially before the 32nd week of pregnancy, a person has a higher chance of developing DCD or dyspraxia. Low birth weight is associated with having DCD, and you have a greater chance of developing DCD if you have family history. The first signs of dyspraxia or DCD begins in childhood during the developmental period, as it is a chronic condition. Dyspraxia persists into adulthood as well. Dyspraxia is more commonly affected in men than in women. What are the person's motor abilities? Really, they can do just about anything. They just have a dampened ability to do any motor ability that mean you can do. Walking, standing, jumping, balance, intrinsic motor movements. All these are dampened and they cannot function as well as me and you. Difficulty in walking up and down stairs, spatial awareness. Difficulty with balance, they may bump into objects, fall frequently, and even seem clumsy. This is reported as a clumsy disease often uh, with parents and other teachers in society uh, saying that this kid is clumsy and is not doing things normally. What's wrong? ADLs are greatly more difficult, but still manageable. Like they can brush their teeth, they can kick a ball, button up their clothes, but it takes a while and it's really difficult. It really does take a lot of brain power for them. All this leads to a less self-care and more dependability on others in their life. Just some subjective thoughts on muscular dystrophy. I see muscular dystrophy at firsthand. My nephew has Duchenne's. So it was really difficult to see him walk not normal. I could see that he's not normal because I know. He's crawling not normal because I know. Uh, but if you were to take a step back and just to assess if he's just a kid, just like any other kid, you assess he's having a happy life and he's doing things just like any other kid. But now he's 4 years old. He's supported. He has supports for his legs. He has braces for his legs so he can walk normally. He can't run like his brothers and sisters did, but he's still to this day functioning normally and trying to do everything his brothers and sisters are doing. He's not giving up. So although he's young, he can do things now. Overall, over time, he will lose these abilities, and his self-care and dependent lifestyle will decrease as well. DCD, on the other hand, psychological factors, you have to think about self-esteem and just the life impact that it has on a person. You can see in the video I have below for DCD that this kid is different, but he's happy, he's laughing, he's doing things, and he's young, and so he doesn't know anything different quite yet. I love when he's hopping on one foot to one to the other, and he's really struggling, but he's thinking hard and he's trying really hard. So he can do certain things of activity, uh, certain ADLs very well, but it's just more difficult and it takes a lot more brain power and more time for them to do it. This does lead to less self care and less independent lifestyle, but overall, they can do certain things on their own. For my videos, muscular dystrophy and DCD, and here are my resources. Thank you.